Michigan hospitals, doctors, and nurses pushed to the limit. How can it keep getting worse? We'll talk with a U of M doctor doing his best to separate fact from fiction. And can you truly heal from a trauma like the one at Oxford High School? Is there a reason to believe we can stop these shootings? We'll talk with Scarlett Lewis, who lost her child at Sandy Hook. Today is Sunday, December 12, 2021, and this is Flashpoint. Hi there, welcome to Flashpoint. I'm glad you're with us. We are just about 2 weeks now from Christmas Day, 2 weeks from my annual Cry Fest, watching It's a Wonderful Life on Christmas Eve. Maybe you've got a lot of routines and traditions where you always find comfort and joy, and yet I've talked to quite a few people who just can't quite settle in just now. There's so many tensions and pressures pushing and pulling at us. The COVID rates remain painfully high. We again need to find a way to flatten the curve. And if you've got school-aged children in your house, good heavens, what aren't you stressed about? Outbreaks of the virus in schools keep changing the schedule. Fights over masks are still really easy to provoke. And now so much added stress. The shooting in Oxford had been agonizing on its own, but then these ripple effects of school lockdowns and cancellations over copycat threats. For many people, this is all more than a hot bath and a lavender candle can fix. So this morning, a couple of conversations aimed at bringing down the temperature just a bit. We're going to talk with Dr. Jim Baker. He's a University of Michigan physician and immunologist who has started a blog called Pandemic Pondering. We're going to talk to him about the never-ending battle to separate fact from fiction. We are also going to talk to someone who frankly knows too much about a shooting at school. 9 years ago, Scarlett Lewis's son, Jesse, was one of 20 children killed at Sandy Hook, along with 6 adults. Even in her moment of grief, she decided to choose love instead of hate. She'll try to help us point a way forward today on Flashpoint. All right, let's start with the pandemic this morning. Michigan cannot seem to get out of the fast lane on COVID-19. We remain among the nation's hotspots, and now we have doctors and hospital administrators begging for help from both the U.S. military coming in to help backstop the care struggles and from those who still haven't gotten the vaccine because they continue to be the ones filling hospital beds and sadly dying. Let's talk about it all with Dr. Jim Baker, an immunologist and founder of the Allergy Clinic at the University of Michigan, but also lead investigator on the NIH National Study on mRNA COVID vaccines. He runs the Pandemic Pondering blog. Dr. Baker, I know you have pondered this now for quite a bit, but I'd like to start today with why can't we get the upper hand on this thing 2 years in particular in Michigan?
Well, Michigan is somewhat unique because early on we did a very good job of protecting people. So we had very few people that got infected over time. And then we unfortunately did not vaccinate as well as we could have. So when we released restrictions, there were a large population of unvaccinated people that got infected and now spread the illness. What we're seeing right now is pretty remarkable. Most of the outbreaks are in the K through 12 situation in schools and in nursing homes. And in nursing homes, particularly, half of the people working there right now aren't vaccinated, which is pretty amazing to think about.
It's astonishing given what we know about the efficacy of the vaccines. We also, I think you and I spoke about this before our conversation here. We've got a little, it's kind of confusing for people right now. On the one hand, they're being told that we really need to worry about the Omicron variant. On the other hand, Pfizer comes out and says, if you just get that third shot, the booster, you should be okay. So where are you, what are you advising people to think right now?
Well, it's been very confusing. And part of this is they're using tests to see if the vaccines will work that really aren't reflective of the real life ability to protect people. I think what we're seeing now is that there is some cross-reactive immunity to the new variant. And I think that's probably a good sign that the vaccines will provide some protection. The real key is that we have to get everyone vaccinated. You know, all pandemics end. I mean, there wouldn't be human beings on this planet if that weren't true. But we have the ability to end this thing in a way that doesn't result in additional deaths or additional hospitalizations. And that's almost entirely with vaccination. So I really am comfortable that if people are vaccinated and are vaccinated well, maybe with a booster shot, they aren't going to be really affected by Omicron the way people have been concerned.
You worked, of course, on the mRNA vaccine, and that was a component of this that was groundbreaking and yet so worrisome to some. We have found so far that this is an incredibly safe vaccine, haven't we?
Yes, people argue that there hasn't been formal approval the way other vaccines. We've given this vaccine to more human beings than any other vaccine in history. And if there was some smoking gun about toxicity or another issue, we would know it by now. These vaccines are remarkably safe and almost unbelievably effective given what we've seen. And the real issue is getting everybody vaccinated so they're protected and they aren't spreading it to each other.
We even had the Attorney General of Oklahoma, though, this past week refer to it as still being experimental. That kind of talk from public officials, I'm assuming from reading your blog, drives you to near madness.
Yes, it's more than a little frustrating. And I think the saddest part is that the people who are listening to this and trying to do the right thing are confused. And they aren't really doing what would be in their best interest, which is to get vaccinated. I mean, we've all seen people come in, and it's not just elderly people, although they're more likely to have problems with this infection, but young people come in, are sick, are dying. We've seen in Michigan, pregnant women who've come in and died because during pregnancy, your immune system doesn't work quite right. These are really sad things to happen when we have a tool we can use to prevent it.
Well, and we also have more doctors talking about the ripple effects. When beds in hospitals, and we see so many hospitals now that are pretty much at the brink, when they are filled by COVID patients, then other things are not being taken care of. Other more routine care concerns become suddenly emergency situations.
Yes, and I can tell you every day at U of M, we get notified that there are 10s, 20s, 40s of people in our emergency room trying to get into the hospital. And these aren't things that could be pushed off. These are emergencies that need to be brought in, and we just don't have beds for them.
So where's your sense of, because everybody keeps trying to figure out where the corner is on all this. If you'd have told us at the beginning that this was going to be 2 years of the way we've lived, I'm not sure many people would have signed up for that, and yet here we are. What do you see as making the real difference? And can we turn the corner, or is this now just the beast that we have to live with for perpetuity?
Well, it really isn't a corner. It's sort of a slope. And what you can see, with other pandemics is that over time, these waves get smaller and smaller and smaller and just basically peter out eventually. One of the things that we're doing now, which is making it harder to understand, we have much more sensitive tests to detect the virus. The PCR test detects the virus to an enormous degree. And in fact, it can't even differentiate if the virus is alive or dead. So in many of these people who are having asymptomatic infections or mild symptoms, they have immunity. They aren't getting sick. And before in a pandemic, we probably wouldn't even know that they were reinfected or were shedding virus. So I think if you look at this overall, these waves have gotten smaller. Certainly in places where more people have been vaccinated or more people have been infected, you're seeing people that maybe get sick or get some symptoms, but you aren't seeing the overwhelming hospitalizations and deaths that we're seeing in areas where people aren't vaccinated. And eventually, that'll all burn itself out.
This is all great common sense advice. If you are looking for more common sense, I heartily recommend Dr. Baker's Pandemic Pondering blog, which we will put a link to on our Flashpoint page at clickondetroit.com. Dr. Baker, thanks so much for the time. Happy holidays and stay safe.
Thank you, Devin.
You bet. We'll be back with more in just a minute, talking about what happened this past 2 weeks ago now in Oxford. This is Flashpoint on Local 4.
This holiday season, the Capuchin Soup Kitchen needs your help. For more than 90 years, inspired by the example of St. Francis of Assisi, the Capuchin Soup Kitchen has been privileged to serve people facing challenging circumstances. Today, the Capuchin Soup Kitchen has evolved to include programs like On the Rise Bakery, providing job training and a fresh start. We can't do this work without your help. Be a friend to the Capuchin Soup Kitchen by pledging your support today.
The big chill is on at Gardner White. Serta Eye Comfort chose us for the exclusive launch of the new Arctic mattress with its innovative 15X cooling system, which keeps you cool throughout the night. Right now, save an extra 10% off. Plus, we pay your tax. Plus, get 0% financing for 60 months, as low as $1 a day. Free box spring, free TV, and it's in stock with free same-day delivery. Exclusively at Gardner White, Detroit's #1 mattress store.
At DraftKings Casino, we give credit where credit is due, in the form of credit. Sign up with DraftKings Casino and get up to $50 in free credits, plus a deposit bonus up to $2,000. That's like extra credit in the form of a bonus. Download the DraftKings Casino app or play online today. Get up to $50 in credits to use on any game, plus a deposit bonus up to $2,000. Now, roll credits.
They're the biggest helmets you've ever seen. In fact, they're giant and incredibly popular.
You have a giant helmet in the Hockey Hall of Fame?
Yes. But there's a very personal reason. Their creator wants to help people make memories.
These helmets are my way of staying alive.
Monday morning at 6:30, Nick Monticelli reveals Steven's story, his battle to make every day count, and his mission to leave his mark on the world.
We're creating something that's timeless.
Monday on Local 4 News Today.
Welcome back. It hasn't even quite been 2 weeks since the shooting at Oxford High School. 2 weeks since we lost Madison Baldwin, Hannah St. Juliana, Justin Schilling, and Tate Meir. Classes won't be held at Oxford again until after the new year. It's still all very fresh, very raw. The prosecution of the suspect and the parents, of course, has a long way to go. And last week, in fact, I've said this many times, I mentioned that if we couldn't muster change and solutions after what happened at Sandy Hook, I wasn't really sure that change is possible. Well, oddly enough, the counter argument to that comes from a parent who lost a child at Sandy Hook. After losing her son, Jesse, Scarlett Lewis created the Jesse Lewis Choose Love Foundation, and I'm so glad that Scarlett Lewis is with me this morning. Scarlett, you are, of course, one of the unfortunate few who have a real sense of what these Oxford families are going through.
Absolutely. I know exactly where they are now. My 6-year-old son, Jesse McCord Lewis, was murdered in his first grade classroom alongside 19 of his classmates and 6 educators. And, right now they're in shock and not believing that something like this can happen.
Yeah.
And trying to figure out if and how they're going to survive.
Because there of course is no there is no return to normal. There is, just like you've had, a completely new life, a different life than the one you expected.
There is no returning to normal. This changes everything. In fact, after Jesse's murder, I realized that I had to be part of the solution. I also knew that every school shooting is preventable. Sandy Hook was preventable. Parkland was preventable. Michigan was preventable.
Yeah.
In fact, there have been 350 school shootings since Sandy Hook, 28 this year alone, and they're all preventable.
But I often use, as I said earlier, I sort of use Sandy Hook as a metaphor for futility. If we couldn't do it then, given what happened at Sandy Hook, why do you hold promise that we can turn the corner, or that we can find a way forward now?
I think it's really important that we shift our focus. We have been focusing on the reactive end of the pathway to violence. That is the attack end. We've been hardening schools after every shooting. We've been changing our strategy. And I think it's time now, and what I've been focused on for the past 9 years since the Sandy Hook shooting, is focusing on the grievance end of the pathway to violence, and that is a school's culture. It is going in and it is focusing on children's mental health and well-being, giving them skills and tools so that they can manage difficulty and challenges and roadblocks in their lives, and ultimately that grievance, should it happen, before it escalates into an attack. You know, what we've been doing now is reacting after each shooting, and we find ourselves always being behind the 8 ball. What we need to do is start being proactive.
And a part of that, you've got a new book called From Sandy Hook to the World, How the Choose Love Movement Transforms Lives. And one of the key components that you are turning to is something known as SEL. Explain social emotional learning.
So these are essential life skills. They're learning how to have healthy relationships and meaningful connections. They're learning how to manage our emotions, how to face, move through, grow through, be strengthened by difficulty in our lives, how to make responsible decisions. All of these skills and tools that we're actually not born with, that we have to learn. And so, yes, we learn them at home, but we're seeing now that they absolutely must be reinforced and practiced at school. And I will say, after I quit my job after Sandy Hook and dedicated my life to being part of the solution and came upon these essential life skills, I realized as an adult that I didn't have all of these. And so I can tell you that I've learned them, a lot of them, as an adult, helping create the Choose Love programming, and my life is exponentially better. These are really important skills and tools. We know that they are the pathway to flourishing. We know that our kids are being subjected to a lot of issues today, more than ever before, especially with social media. We know that kids, by the time they graduate from elementary school, they will have seen 8,000 violent killings. And by the time they're 18, over 200,000 acts of violence. And the study that I'm talking about was done in 1998. I can't even imagine what the numbers are now.
Oh, exactly.
And if we're going to allow our kids to be subjected to everything that they are, we really need to give them also the coping mechanisms that they're going to need to be able to handle all of this. But
the last thing I wanted to talk to you about, though, was how you were able to make the turn as early as you did to seeing this in a new way. All 4 funerals for the victims here were held this past week. At Jesse's funeral, you spoke about choosing love. As long as you're angry, or if you've got hate in your heart, then, as Nelson Mandela sort of explained, someone else is in charge of your life. You somehow seem to understand from almost the drop that that you needed to look at this a different way. How would you advise parents right now who are hurting in such a horrendous way to choose something other than anger or hate? How did you do it?
Well, it's a different path for everyone. My 6-year-old son actually left a message on our kitchen chalkboard before he died. He wrote 3 words: nurturing, healing, love. They were phonetically spelled, but the meaning was clear. I knew if the shooter had been able to give and receive nurturing, healing love, the tragedy would never have happened. These kids actually aren't born mass murderers. They are cultivated into what they become through difficulty and challenges and roadblocks that they don't have the skills and tools to manage. And so I just decided that I did not want to become another victim. I had, an older son, Jesse's older brother, and I wanted to be a role model for him on how to learn from this, how to grow through this, how to actually even be strengthened by this, and then to take the wisdom that we've learned and use it to help other people. And so in this kind of conscious modeling that I've done, it's really kind of helped me rise to the occasion and hopefully be part of the solution. I feel like it's time now. Enough is enough. We can prevent school shootings, but it's going to take everybody really listening to what our kids are telling us. Our kids are hurting and they need our help. So many times they actually talk about what they're going to do. And we need to listen to them. Yep. And we need to be giving them what they need and teaching them how to manage these difficult emotions that they have. What we've been doing isn't working. So we're going to have to shift the way that we've been looking at this issue and start focusing on proactive prevention.
Well, and I know a lot of people are listening and hearing you. Your grace and commitment have been extraordinary in this. I'm so glad you spent some time with us today. Thank you so much, Scarlett.
Thank you.
You bet. We'll take a quick break on Flashpoint. Back with more in just a minute.
This is a Gardner White exclusive. Serta chose us to be the elite store for the new Serta Perfect Sleeper Ultimate Hybrid with memory foam comfort and inner spring support. Save up to $600 off the lowest price. And right now, get a Serta Ultimate Hybrid, Queen or King, just $12.99. Plus free gifts. That's as low as $22 a month with 0% financing up to 60 months. In stock with free same-day delivery. Exclusively at Gardner White, Detroit's #1 mattress store.
Come explore the new Total Wine & More and discover the largest selection in the state. With over 6,000 wines, 450 from here in Michigan, and over 2,500 beers, including 600 of them brewed by Michiganders, and 5,000 spirits, 325 made right here. We've got more local products than anyone, with the biggest selection of spirits, all at state minimum pricing every day. Now open in Ann Arbor, Novi, and Sterling Heights.
Aaron Rodgers and the Packers are pushing to make sure the NFC's road to the Super Bowl runs through frozen tundra. But when the Bears come to town, with this rivalry, anything can happen. Sunday Night Football on NBC and Peacock.
Brought to you on Local 4 by FanDuel Sportsbook. Make every moment more.
All right, before we go, after all that, I just wanted to spend a minute helping you find a little solace, a little peace from all the chaos that we've been talking about this morning. Clinical psychologist Dr. Donna Rockwell is here. We turn to her time and again on Local 4. Donna, I cannot imagine that you have ever felt more thirst for the services that you and your fellow mental health experts provide.
Thank you for having me today, Devin, especially during this time when people are suffering and they don't know really where to turn or how to feel better. So yes, I'm hearing so much of it in my office. And the one thing we need to understand is that what's been attacked is our central nervous system. Yeah. We are a body, and our mind is connected to it. So in order to settle our emotions, we need to actually settle our body. So what people need to do is really remember to breathe. When we're under stress, we hold our breath. The most important thing is to remember just to breathe. Let the out breath go. Allow the in-breath to come in, and allow our entire physiology to settle. Then we can actually be centered even in the midst of chaos.
I think some people think that being told to breathe is kind of silly advice. Of course I'm breathing, I'm alive, but I think the kind of breathing you and others are talking about is with a great deal of intention and understanding that's, breathe in, breathe out with thought.
Yes, and it's awareness, right? It's awareness of breath versus just breathing, because actually we do hold our breath a lot, and that really calms down our fight or flight response. We're in crisis right now, we're in fight or flight. In order to feel better emotionally, we have to calm our bodies down. So yes, to remember to breathe, and to also know that however we're feeling, our children can feel it. Yes. Only a small percent of our communication is verbal, so we need to really stay grounded for our children and the people around us who need to be settled. So remember, we're setting a model. for the other people around us, particularly children who absorb our emotions like sponges. And we need to be sure.
Really not easy to do if you're so stressed yourself. But if you're seeing your children in a great deal of stress, and there's so many reasons for that right now, we can't even begin to catalog all of the pressures that school kids are feeling right now. What do you do to help somebody else, especially someone younger, try to find a little bit of balance and peace?
What children really need to hear is that they're safe and that there are grown-ups in charge. So you can be that grown-up. You can be the one that lets the child know everything's going to be okay. I've got your back. They're taking care of this problem now. We're not going to have to worry about this in the future because the grown-ups are taking care of it. A child just needs to know that you're okay so they can be okay, and that there's someone in charge who's doing something to make it different from now on. You can point to the news and say, listen to all the laws that they're going to come up with. Look at how they're reacting to this issue. Yeah. Everybody cares. You're covered. We got you.
Yeah. Lastly, I think that if it's easy to feel like there's some kind of weakness in you if you're not getting through this in flying colors. Really important to look around and realize that these are extraordinary times, and it's not that unusual to be out of step with what's going on.
It is normal and natural to be in a mess right now because it wouldn't make any sense to not be. So we have to allow ourselves to have the feelings that we're having and to know that we can just settle ourselves. Even just a self-hug, you know, and closing our eyes for a minute and settling is enough to bring us back so that we can be available for other people. And to know, yes, it's completely normal to feel like this right now.
Natural to know that we are in a mess. Donna, thank you. It's always good to talk to you. I really appreciate ending the program on these notes. Thanks. Take care.
Thank you, David.
And that is going to do it for us this morning. Thanks so much for being here. Hope you have a great week.